Well, as I mentioned, this discussion starts, at least today, with that article in the Des Moines Register. And with me today is the very respected senator from the state of Iowa, Senator Grassley. And I just asked Senator Grassley, what impact do you see arising out of this health care law in your state and even more broadly across this country?
I think number one, thank you, Senator Johans, for your leadership in this area, and you've spoken on regulations quite regularly on the Senate floor and also on our caucus, and I thank you for your leadership in that area. Number one, I would say there's a certain irony between a president who's going around the country now talking about we got to pass legislation to create jobs, at the very same time as you demonstrated in your remarks that there's a health care bill law being instituted that is making people unemployed. There's also a certain irony in what the president does and the Secretary of HHS does with what Speaker Pelosi said at the time the bill was up. You know, we got to pass this bill to see what this bill really does. Well, now we're finding out really what it does. And people don't like what it does. You spoke about regulations causing this unemployment. And you spoke about 10,000 pages of regulations. That's probably 10,000 pages of regulations out of the 66,000 pages of legislation or of regulation that we've had just this year. Just this year. And 10,000 of that deals with health care. But think about the other 57,000 pages that deal with other pieces of legislation that is a problem for small business. Particularly small business. This, I guess, is a problem for all business, but particularly for small business. So far, I think just a few regulations have been issued, adding up to that 10,000 pages. People can read this 2,700-page bill and understand what's in it, and most of them read it and understand what's in it before Speaker Pelosi said we got to pass it to find out what's in it. I didn't like what's in it. But in this bill, there's 1,693 pages of, let me back up. There's 1,693 delegations of authority to write regulations. So if you got 10,000 pages so far, just based upon the few regulations that have been written, just think what it's going to be like when all of the pages are printed for the 1,693 regulations that are done. So I think we're just seeing the cap of the iceberg so far in this legislation. The damage that's done to employment and lack of job creation is just starting. That's my comment on what you do. I have some remarks I'd like to make if it's okay with you, but I thank you, and if you have to go to a committee meeting, I understand. This is not the first time that this situation has happened in Iowa, and it's coming at a time when people need stability. American families are struggling to put food on their tables, pay their utility bills as winter arrives, and purchase health insurance as costs are skyrocketing. In other words, the president's promise, pass this legislation, is going to keep health care premiums down. Why, that's misleading people. At a time when, as Senator Johans said, another promise made was if you like what you have, you're going to be able to keep it. Well, we've got, I don't know exactly the figure, I got it here coming up. There's a figure of several thousand people in our state that aren't going to be able to keep the health insurance that they like and they already have because of this company closing down individual policies. Unemployment continues to hover around 9%, and million Americans are underemployed. And here we got a health care bill that's causing more people to be unemployed, as well as not keeping the health insurance they want. With the economic situation that our country's facing, Congress must re-examine its actions and realize the errors through partisan votes that are made because of partisan votes. And this bill was an entirely partisan piece of legislation Unlike most social contracts in America that have been passed, like Social Security, Medicare, and Medicaid, civil rights legislation, those were bipartisan pieces of legislation because it was felt that when you're making this difference in America, you ought to have a broad consensus that major changes like this ought to be made. But in this particular case, it was very partisan. So I want to go over what Senator Johanns said about the Des Moines Register article. The American Enterprise Group, an insurance company participating in the individual health insurance markets in Iowa and Nebraska, are leaving the market. This action shows the importance of repealing and replacing the health care overhaul passed by Democrats in Congress, signed by the President last year, before the situation would deteriorate even further. Just think what it's going to be like when we get the rest of these 1,693 delegations of authority to the bureaucracy to write regulations. American Enterprise, that company, notified 110 employees in Iowa and Nebraska that they'll lose their jobs sometime during the next 3 years. American Enterprise is leaving the individual health insurance market as a result of the instability caused by the implementation of this health care reform bill. American Enterprise stated that it will no longer sell individual health insurance policies because of the regulatory environment created by the health care reform bill. This is an isolated incident for Iowa, this one company, because the Principal Financial Group left the small group insurance market in 2010, and Principal Financial isn't any little Main Street operation. It's one of the major financial groups in the United States, but still they could not find it to be competitive to stay in the individual market. This has cost then many Iowans their jobs while leaving scores of small businesses and their employees to choose from health insurance plans in a health insurance market where there is less and less competition. The regulatory culprit in this instance is a medical loss ratio regulation of this legislation. This regulation requires insurers to pay a certain percentage of premiums and claims. And I know supporters will defend the regulation as quote unquote keeping insurers in check, but the real world effect is to force insurers to leave the market, thereby reducing competition and choice available to consumers. Just exactly what the President promised, that we are going to have competition, keep price down, and people are going to have choice. They're going to be able to keep what they want if they have it. But in this case of these people, that isn't a promise kept. That turns out to be a falsehood. The small group and individual markets happen to be very volatile. That's the problem. Insurers bear risk and set their premiums accordingly. Insurers are making a rational decision to get out of the market because the risks have become too great. Competition is reduced, costs rise. Once upon a time, the President promised Americans that if they like the insurance plan they have, you can keep it. This is more evidence that promise rings hollow. This recent plan pullout will leave 35,000 individuals without insurance plans that they have grown accustomed to. Forcing people to choose a different insurance option can lead to higher costs and may limit the health care accessibility that these individuals have depended on for years. This is especially detrimental when these individuals have pre-existing conditions or an acute chronic disease. The President specifically promised that if these people want to keep their health care coverage, they would be able to do it with the passage of that law. This is just one of the many examples of how this overhaul has led to broken promises made by the President when pushing through the passage of this legislation in a partisan way. These problems will certainly continue as more regulations are written. The Congressional Budget Office expects people in the individual market to see an average of 10 to 13% rise in premium costs, and solely based on the passage of the health care law. Is that increased accessibility or affordability? No, of course it isn't. Not only has the health care overhaul caused health insurance companies to leave parts of the health insurance market and health insurance costs to increase, it has also put added burden on employers. Some employers will no longer offer their employees health care coverage. Higher taxes and mandates put on employers by new health care law have left many employers without resources to maintain current coverage for family members of their employees. The negative impact of this legislation is having on large employers and those insured by employers is demonstrated by the National Business Group on Health. In its recent annual survey, overall plan costs for large employers are expected to rise by 6% in 2012. The National Business Group on Health also notes that 7 out of 10 employers will lose their grandfather status, meaning that employees will lose their current health care plan and employers will be subject to additional regulations. According to the same survey, 3 out of 10 employers are unsure if they will continue to insure employees due to the health care bill. Other employers will increase the employee's share of insurance premium, and many employers state that they will likely lower the level of health care coverage offered to their employees. Walmart, as an example, will not allow many of its new part-time employees to receive health care insurance through the company. Many of these workers are already underemployed. They work hard, yet don't always have adequate resources to purchase health insurance on their own, especially as costs in individual insurance markets continue to increase due to the new law. Additionally, many businesses are simply dropping coverage for their own employees because of the extra cost incurred in the legislation. It's more affordable for some employers to drop coverage for their employees and pay the fine associated with the employer mandate. An employer must provide health insurance for their employees if they have more than 50 employees or 50 full-time equivalent. Employers who are required to insure employees will be fined $2,000 per employee who seeks health insurance through one of the exchanges created under the health care overhaul. And any employer-sponsored plan must meet the definitions of HHS on what an adequate plan is. This requirement will increase health insurance costs for employers and employees when they must upgrade health insurance benefits in order to meet the standards defined by the Department of HHS. Forcing employers to provide health insurance when they have a tough time hiring new employees just adds to the burden employers are facing in a struggling economy. Employers will likely pay their increased health insurance costs by reducing employee take-home pay or by increasing the employee share of health insurance premiums. Also, employers will continue struggling in future years as the federal government increases year by year the requirements of health insurance benefits needed to avoid a penalty. Furthermore, employers already faced with economic uncertainty have to deal with the government regulations that continue to change, adding to uncertainty. HHS rule released last November allows fully insured group plans to switch insurance providers as long as the insurance benefit provided to the beneficiaries remain comparable. However, this is only for group plans that switch after November 15th last year. HHS wrote this new rule so more group plans can find affordable coverage and shop around for similar coverage at cheaper rates. But the group insurance plan carrier was changed before, if the group plan carrier was changed before November the 15th, the plan would lose grandfather status and then be subject to a whole bunch of new regulations. Ironically, what created the need for this new rule was another rule that the President's administration and HHS crafted June last year that stated plans would lose their grandfather status if they switched carriers. This chaotic situation shows what happens when the government is given more authority to regulate the health insurance market. Madam President, what we have here is a mess. We need to put a halt to the implementation. We need to repeal the law and start over again with common sense solutions. We need to move away from the regulatory and bureaucratic nightmare that is costing Americans their coverage and too many Americans their jobs. And with 10,000 pages of regulations at this point, just think what it's like when all 1,693 regulations get written. I yield the floor.